Hi, my name's Dr. Steve Fawcett. I'm a GP in Stoke-on-Trent and I'm also the medical director for the local CCGs. We set up a Choice and Referral Centre about 4 or 5 years ago now, and we set it up under the pressure of what was going on at the acute trust. Essentially, the trust was getting more activity in than they could ever reasonably hope to manage, particularly when they had problems with non-elective care, winter pressures, where elective capacity was getting taken out of the system. So the consequence was that patients were waiting really very long time periods. And the other feature really locally, which may be true elsewhere, is that our local patients have got a huge degree of loyalty to the acute trust. So despite long waits, they are often still opting to go to the acute trust. Now the downside of that is it meant that the patients were deteriorating whilst waiting for treatment, which ultimately made their outcomes less good, I think. The other problem, of course, is that they were anxious about when they were going to get seen, and the first point of contact was back to the practices to try and chase up referrals, for which the practice could actually do very little because a waiting list is a waiting list. And then there was an element for us about wanting to look at other pathways where patients didn't need all the singing and dancing whistles of an acute trust, where they could be managed in a different environment, for example, by consultant physios or by other types of what we call Tier 3 or community-based services. The patient benefit of the Choice and Referral is that they have a single number to call, and because this is a bespoke service that's just for them, it means that they get the time to discuss what they need to on the phone. So offering choice in practice is not as complete sometimes as it might be, because people are under time pressure, particularly if it's the clinician, but even if it's an administrative team. And the Choice and Referral Centre do nothing else practically but offer choice and manage the patient pathways, so they have more time to do it. They're really expert in terms of what's on offer, where, and what the pros and cons are for individual providers. So actually patients are enabled to take a much better choice. They also help because what they're doing is they're diverting patients away from services that are overloaded and can't cope and won't be able to see them for a very long time, to services that are just as good but can see them much more flexibly and much more quickly. So having choice and referral means that the patients are getting a better service, better choice in a quicker time. The benefits of Choice and Referral Centre to the practice are a number, but the key bit is that the practice can send the referral under e-referrals to the Choice and Referral Centre, and they know that that referral will be managed. So there's no worry for them, there's much less hassle. They don't have to worry about trying to navigate the system. They know that Choice and Referral Centre will manage that from start to finish, and then the patients, if they've got a problem, can contact the Choice and Referral. The other issue though is that by doing this, besides helping a hospital that's under strain, you're also potentially maybe helping the whole health economy, because where you have a Tier 3 service and you can direct the patient to that service, you can allow the hospital to see only the cases they really need to see. And also by going to a Tier 3 service, it means the patient's getting timely care, but also care closer to home. If we're honest, most patients find parking in an acute hospital a very difficult challenge, let alone just navigating around the building. So being able to see somewhere in a local clinic, but actually get just the same quality of input or intervention is really useful.